share some perspectives. Has anybody been able to use some of their empathy tools, your newfound empathy tools, to really connect with Maggie, look at these pictures from a new perspective? Did your partner share an interesting story that you'd like them to share with the rest of us, for example? I think we got a volunteer, maybe? Is there a volunteer? Yeah, please.
So I'm going to go first because Brian and I are highly analytical, so it's only going to get better from here. So if we wait to the end, it's not going to be good. So here's what we had. That Maggie is a woman in her early 20s, pregnant for the first time, which we realize is hypothesizing. Definitely interested in dance, possibly a ballet professional. That she's doing a lot to try to make it a nice environment for her child between, she's eating well, possibly there's vitamins there, she's still exercising. That she does have a belief around, expression, and there was a lot around nature. There's a couple of cards around there about, nature's influence on kids. I think there was a thing that said trees are the best mobiles. So I think she has a lot of beliefs in, physical expression, nature. What else do we have? Let me see. She likes cats. Anything I missed? Yeah.
Great. Thanks for sharing. Yeah, that's awesome. Does anybody want to add to that? Yeah, please.
Thanks. That she was excited about being pregnant and being a mom, but also maybe a little ambivalent. The picture of the magazine with the baby with the lasers kind of clued us into that. And that she was getting ready. She had a stroller and so forth, but in other ways wasn't ready. So the alcohol and what looked like maybe some chemicals on the ground next to the wastebasket. What's that? She hadn't baby-proofed the house yet, in other words. What am I leaving out?
We kind of inferred that, that she's a pretty free spirit, and that, awesome. Fun is a big part of her life with her friends, if you see what she's documented around house. And that's maybe a source of concern for her because it's a big life change, this balance now.
Nice. Great. Any other reflections or observations either about Maggie or just about the exercise?
Well, I think can see she's a dancer and she's quite young. I'm thinking of she's maybe very active, want to go out and be very active at the old time, but now she got pregnant. She had to keep healthy to stay at home. You can't go to pub with, and at the time. And maybe I'm judging, but I feel that she's feel a little bit nervous about this changing. I don't know. To me, it feels that she don't really seem that happy.
Yeah.
From the well, she smelled in the picture, but I think she really missed the old dancing time, free lifestyle, rather than be a good mom. She see the car like 5-star mom, maybe from her husband or relative, something to encourage her.
Great. That's great. Why don't we go here and then we'll go here, please.
It looks like Maggie's in a transition period in her life, from taking pictures of your cat to the baby books to a time when alcohol was outside to something else. And then there's that subtext in the background, the medications on the sill. I think she has no fear of the female form or her body or imagery that she keeps in her house, but there's something about a chronic condition that's in the background as well. Yeah. Prescriptions you take every day. Usually when there's more than one, you put them in a pill box. So there's something else in the background around a health-related concern that may be part of this transition, and maybe it seemed there.
Nice. That's great.
So I think I'm outside of the group, what we discussed, but I'm curious about the alcohol and the medication, because if you're pregnant, you're not really drinking, hopefully, if you're excited about it. But I actually kind of, and again, creating a hypothesis, think that there's something going on outside. Maybe there was a pregnancy that was happening that maybe isn't any longer, or there's an issue with the husband is deployed in the military or somehow not present if there is a husband, and that there might be some depression going on, but I'm not the majority here, so.
A lot of hypotheses built into that one. Wow. Where do you want to go? Yeah, go ahead if you have the mic.
Well, I guess I had my hand raised because there wasn't, we had pictures of the dad or who we presumed was the dad, but we didn't see him.
Yeah.
We didn't
Good.
see him with her.
That's interesting. Yeah.
So kind of along what you guys were saying, I think there's something going on with a significant other, whether they're deployed, they recently passed away. And if you look at a few more of the pictures, you'll notice like half of the bed's not slept in, the toilet seat's not left up, things like, I know, I mean, but think about it, if you, so, you have a cat.
Some keen observation skills going on up here. I like it.
That's so funny. I looked at all those pictures and I said, Stacy looks like she's really happy, really fun, has a lot of friends, probably has a lot of dinner parties where they have some fun drinks before. I mean, I didn't see any depression or nobody's just like, she looks like I'm my best friend.
The other thing, kind of a very basic thing is she's clearly got the means to stock a refrigerator. Which perhaps in another apartment we wouldn't be seeing. So that says something about the means she has.
Yep. Great.
Yeah, I think the video you showed us actually sets us on a path that you start creating assumptions maybe based on what she's thinking, what kind of thing could be going wrong with her life as opposed to what could be going right. So I think, when you walk into the room and you start asking the patient, your assumptions may lead you down one path. And so I'm just making that point as we look at these pictures.
Perfect. So I'll use that as a bit of a jumping off point to talk about, this type of work is that you're right, you can get into this tendency to start to make hypotheses or assumptions or judgments and those types of things. And it's somewhat unavoidable. But our design researchers and where the skill comes in is when you're usually going to these environments and you're collecting, you're doing this not only once, but probably between 10 to 20 times for any given project, right? It depends on the scope and all that kind of stuff. But we're not doing this for hundreds of people. Because you're going so deep and you're going so rich and you're not looking to validate anything, you're just really looking to learn. And what usually happens if you start to see some themes across about 7 or so people, you can start to be pretty confident that that's a theme that's going to be generalizable to a broader population. And but when we go into these environments, we're just in mode of capture everything, right? And so you probably got the experience from looking at the pictures that capturing everything can, there's an art and a skill to that, right? Because noticing the toilet seat, I mean, even, I gave you some time to look at all these pictures, but still that's a lot of information in all of these pictures and noticing all the details, and because some things you just like overlook. Oh, it's just like a picture of her living room. Okay, cool, next, but there's a whole bunch of little things in there that you can see that you're like, oh, that's interesting. And how do you pay attention to all those things and capture all that? That's the thing, right? You don't want to interpret it. You don't want to evaluate, you don't even want to make decisions about whether, that's really important or that's not important yet. You capture all that information, then you put it together, and I'll show you this next step of the process about how do I synthesize all of that information in the most meaningful way across more than one person. But before we go there, just to kind of wrap up this exercise, what's also fun to do in this process is I have a really short video about Maggie. And it's her talking, actually, and she's going to tell you a little bit about her life. The images you'll see are the same images, I think, that are in the photo book. But I'm smiling a little bit because it's going to be interesting because so many things about what you said were actually pretty amazing because you'll see a lot of them are reinforced here in this video. So I'll play the video, and then we'll move into the next section, which is around synthesis.
I like it when something makes me cry or makes me really happy. Some of the challenges specific to dance have to do with body image and this ideal of perfection. It's all about, such a premium is placed on how you look because it's a visual art form. And it's also challenging because becoming a mother, I don't know when my next show is going to be. A good day would be accomplishing. I can't relax until I have accomplished the things I want to get done. So for a healthy body, to me, that means exercising and eating well, getting fresh air, connected with other people. And then mentally, one thing that I'm striving for, everything is okay, that it's not catastrophic if I'm feeling depressed one day. Like kind of having a more big picture view that feels like a healthy way to be. I feel guilty for not meditating, like I feel like it would help me. I went on a silent retreat one time and hated it so much. Being alone and quiet with my thoughts, like I am naturally kind of a busybody. Like I like to keep busy, but I'm not as happy when I don't have things going on. It makes me anxious. I would say since meeting my husband, I've been the healthiest and the happiest that I've ever been. I've always been healthy. I've always been very active and eaten really well. What has made the difference for me is not drinking as much as I used to. I used to smoke a pack a day, and quitting smoking, that's something that I did to take care of myself. And then all of a sudden, I fell in love with someone who was really good for me instead of being in a relationship with. I'm excited to meet this person. I'm excited to have this bond with my husband and be a family unit. I think my main worry is postpartum depression. Knowing the things about my personality that I don't like to be stuck at home. Oh, and the lack of sleep thing, like that's pretty major mega too. It'll be more of a challenge to exercise, and I don't know when I'll be able to perform again. To wish me luck and to give him confidence, my husband just made this little star and wrote my name on it and put it on the door. Then when I got pregnant, he made a little teeny tiny star that said B for baby and like stuck it up there with it. Lifted up, but it was just a cloud and it said mom.
So that can be kind of fun just to hear from Maggie herself and add a little more richness to see if some of your guesses were on or off. And I mean, the goal wasn't there for me to test whether you were making good deductions or bad deductions. Really, the goal of the whole exercise was to probably appreciate how much you could pick up just by observing things about Maggie and Maggie's life, right? And the only way you're able to do that is by being in her environment. I gave you some photos, but ideally you're in that environment. And I can't tell you how many times, like one of the biggest things that we notice, I'll use an example of like people will say something, but then everything about them says the opposite. And one of the biggest times we notice that is when we ask people about health a lot. And everybody tells us they like to eat healthy. But oftentimes we're in their health, or we're in their home, right? We're in their home. So like, mind if we head over to your fridge? Can we can you show us your kitchen? And you pop open that fridge and there's not like one vegetable in the entire fridge. I mean, that's like one of the biggest examples where, is it a value, because people say it? Is it a value to them because they say it, or is it actually a value when it can, when they actually do it, when they're actually able to deliver it? And what's the difference between the two, right? And if they say they want to eat healthy, but yet everything they do is, then what's the gap between the two? Are there barriers? Is it just a different perspective? What's going on there? And so, being in these home environments or being where people can actually point to things, or we can point to things to draw out things, it gives you access to a level of understanding you would never be able to achieve by going to interview them in an office or even in a focus group room. And hopefully I wanted this exercise to give you appreciation for the richness. You can start to get out and understand about people's lives by being out and spending time with them. Well, that was one step of the design process, right? And I wanted to go a little bit deeper there just because it's kind of a fun activity to do to really spend time seeing the world through someone else's point of view. The next step in the process is to synthesize, to capture all of this information. Now you think about the amount of information that's being pulled together here, it's actually pretty overwhelming. Imagine that we usually will spend, when we're doing, full-blown design projects and we're bringing, a full team to it, we usually do our research with 3 people. One person is talking the entire time, one person is writing the entire time, and the third person is usually either videoing, the whole thing or taking pictures of the environment while we're there. So, I mean, our goal with going in there is to capture everything and anything as much as we can about this person's life so that we can bring all that information back together and start to put it together with all of the other information we collect across those 10 to 20 interviews or research sessions. When we start to bring things back, a lot of it gets filtered out in the form of Post-it notes. And this is, Post-it notes are synonymous now with innovation, for good or for bad. But what Post-it notes allow us to do is take pieces of information and be able to move them around and make different associations with information. And also to have a lot of information, more than you can hold in your mind at any one time, in a visual manner, in front of you. And so we'll take those Post-it notes and start to pull pieces out of the interviews and put them into categories and, and get them all together. But then it all starts to usually manifest itself in the form of a project room where you're getting all this information in a workable format in the context of a visual space. Now, some of you may be familiar with some of these environments. For the most part, these types of environments are pretty foreign, at least in many healthcare organizations. This is a picture of the space that we created at Mayo to do this work. Probably a little more fancy than what any of us may need to do this work, but just to give you an idea of the type of environment. Mostly I want you to look at modularity, a lot of whiteboards, a lot of work surfaces, working in a very, very visual manner. And by the way, just remember I told you about the design of the lab itself was in the clinical space. So there's a hallway right here alongside the glass, and right on the other side of this hallway are all the exam rooms. So when I talk about like in the clinical practice, the glass wall separates, the design teams from where physicians and nurses are working with patients. And I could spend the next hour telling you about the value of having a live working prototype space there for this process. It was very, very powerful. This is a picture of the new Mayo Clinic Center for Innovation, again, having workrooms where people are taking this information from the field, visualizing it, and making it available in the context of a space to work with that information. Here's a picture of one of the rooms that we had for a recent project that we did around alleviating anxiety associated with health and healthcare. So each of those vertical boards, you can see those are 8-foot tall pieces of foam core, and each of those boards has one of the research subjects that we visited on it. And you can see there's a lot of pictures, and then there's also obviously a lot of notes that accompany it. And it's so important to bring back those pictures, and then this team is living in this space for the rest of the project. Because like every day you remove yourself from seeing that empathy video or spending time in that person's house, you start to lose a little bit of what you experienced, right? And so we'll bring that back in form of visual. We'll get pictures of them up there and big quotes and everything. And so that's in the space the entire time. So that continues to help, drive that empathy perspective all the way through the entire project, even as you get further and further away from actually being there and experiencing, their lives. Then you start to make associations. So on that previous board, we got the individuals, and we're getting all the information about the individuals out. And now we have to start going across the boards, to start to identify those themes across many, many different people. And that's where you start to move everything around. And things, and you start to make patterns of things. And that's where you start to identify needs and insights. And so we start to get into a little deeper conversation about, okay, well, not only what was happening at each of the individual levels, and start to pull that out, right? So we're pulling out little pieces of things that they said. We're starting to put them in forms of frameworks, which I'll tell you about in a little bit, to start to think about ways in which, there's values, there's opportunities, there's needs, and what those mean. Some of the exercises we do with folks, is that in addition to observing and talking and listening, oftentimes we'll prepare some exercises for people to even draw more information out of them. In this example, we had a bunch of flashcards, kind of about the same size as the cards you guys were using today. And we asked this gentleman and these folks for this product to categorize these cards into health, sort of health, and not health. And one of the, I went on a few of the the research visits here, and one of them that I was on was so interesting. It was this one here that's documented. So we have the insurance card in there, you know, in the deck, right? And so this gentleman, he's a late 20-year-old guy, and he's going through the deck, you know, and it's like, oh, a doctor, clearly health, you know. Oh, fried chicken, clearly not health. You know, as surprising as that might be, but not health. As a late 20-something-year-old gentleman. But then he got to the health insurance card, and it wasn't where he categorized the card that was interesting, because what you didn't see here, and what you wouldn't see on a market research report, is his processing when he saw that insurance card. Because literally, so he's flipping through the deck, and then he gets the insurance card, he's like, literally look like this. What's an insurance card doing here? What does that have to do with health? That's what he said. I was like, what? You know, and of course, I can't influence the stuff here, and I'm just like biting my tongue. I'm like, you gotta be kidding me. But it's so surprising, right? That instance right there. And he actually took that card, he set it aside. He said, I don't even get this. I don't know why this is here. Let me go through the rest. And he kept going back through. And then finally at the end, he came back, and it took him another like 30 seconds or a minute to like, okay, well, I guess it goes in the middle here. That was really interesting. So more of this type of stuff where we're putting together, this is that same visit. Another thing we did is ask him what are the attributes of a health partner is. If you had to think about a partner for health in your life, you know, what would that mean, you know, and what's important? How would you think about that in your life, and how would you define that? Again, a way of starting to understand, you know, his perspectives, his view on the world, what he values. It was really, really interesting. So out of all of that, all the needs and the perspectives and the understanding of the values, sometimes you'll be able to pull out insights. And insights are kind of like aha moments, right? And finally you start to get to them. You don't see them usually when you're sitting there. I mean, that was really interesting, that standpoint, but I don't know that was an aha moment. And you usually don't see the aha things until you bring all this information back and you start to look at it and you start to think about it. But an insight will appear, and it'll really take that individual story, and it's like, you know what, this seemed to manifest itself across all of these folks. Did you notice that? It was a little different, but each of them said this and that way, and that really kind of changes our perspective. And then that helps you really, you know, shape your design challenge and where it goes next. And then what we do with all those insights and those needs is you take a group of frameworks and use frameworks to start visually putting these things together. And the best thing I can do, I mean, you guys all know what frameworks are, but the best way to talk about them is to show you examples of frameworks, right? And so they're visual kind of models and ways of thinking about information. So examples of frameworks, you know, maps, Venn diagrams, 2x2 matrices, process maps. You know, we use journey maps many times to start to make sense of all of this information, to start to provide some context for the work. This is a really, really high level one that came out of some of the work that we did that we use as a foundation to communicate, you know, a customer perspective to the rest of our organization. But beneath that, it started to get into even more details about, okay, so if you take the prescriptions circle here, and then you can actually go deeper around, okay, well, what does that prescription experience look like for seniors? What are some problem areas? What are things that work? You know, and how should we be thinking about that from an organizational perspective? That tool is amazing in terms of helping the organization really take a more of an empathetic approach to thinking about our customers. But many times when we're in the middle of the work, we use journey maps at this level, which is a lot more kind of helping us get into the real details of what's going on and identifying opportunities at a much more deep and rich level. The interesting thing about journey maps or experience maps, many of you guys are probably hearing that language a lot nowadays, is there's many, many different types of journey maps, all with different purposes. And these are the types of tools and frameworks and skills that professional designers in the fields of product or industrial or service or interaction design, most of them should be learning about. That's part of doing great design work, is using frameworks to think about how you do things. I was recently at the Savannah College of Art and Design, the first school in the US that's now developed a degree in service design. They'd have an entire class about using journey maps and experience maps to make sense of information. An entire class. And so they actually, one of their first assignments is to take a public service, for example, like the bus transportation service here in town, and use journey maps or experience diagramming to help kind of take a look at that process. And you have to use at least 8 different journey maps to do that. So they used this is just one kind of construct of a journey map. They had to use 8 different varieties of journey maps. And the interesting thing, I was talking to some of the students about that exercise, and it was a huge learning process for them because they're like, every journey map tells us something different. It gives us a different lens on what the experience is like. It gives us a little different lens on where there's potential opportunities, different lens on what we should be doing more of, doing less of, all this types of stuff. So it really is a pretty deep competency to understand how to use the tools of journey mapping and experience mapping to help inform, how you decide to go about solving a problem. So out of that work, out of using frameworks and putting together themes, finally we start to identify opportunities. And an opportunity is kind of like your design challenge, but it's narrowed down to a little more specific or granular level. And this becomes the foundation then for finally figuring out, okay, well, what are we going to do? What are we going to solve? What are we going to put in place? That's the next step then, is to go into creating. So if you remember the diagram I built with the bell curve at the beginning, I just want everybody to recognize that we haven't once talked about potential solutions until we get to this point in the process, which is usually, I'd say, about 2/3 of the way into the process. And the ability to do the really good work in this way is to not come up with a solution before that, which is extremely hard for most folks to do. And I can confirm that because I work with my students all the time, and I tell them, if you even think that you know the answer to this problem before we're 2 months into this class, you get an F. So that doesn't help. Because we naturally try to get to solutions. Think about it. We've been trained our entire life when faced with a problem to come up with a solution, and we've been rewarded our whole life. The faster and better we're able to do that. So it's like a natural kind of instinct for us to see a problem. I want to find that solution as quick as I can. So to get really disciplined at this process involves not jumping to solutions until you gather all this information and let it mess up your head for a long period of time before you start to put it back together to formulate a solution. And that's where we are in the process now. Before I dive into this and give you an overview about how you do the solution part, do I have any questions about that very complex and probably the richest and most skilled step of the process, which is that synthesis process?
This looks like it's required a lot of work to get to this point. And so if you have an innovation team in place, then that may be reasonable. But when you're thinking about those initial 3 rings of desirability and feasibility and another one. Viability. So you may be bringing an idea to somebody that you're trying to demonstrate has potential financial benefit to assemble a team, and you don't have the resources to do all this work to get to the point.
Right.
It's kind of like doing the work to submit a grant. Mm-hmm. Any suggestions about how to truncate that initial process to get buy-in?
Yeah, don't. No. But no, it's hard, right? Because to get the resources or the time, a lot of it's not even money and people. I talked about people being earlier, but a lot of it's the time. And I don't need a lot of time, but can you just wait to expect an answer for a month, or a couple months, so we can go and we can empathize with some people for a little bit and really develop our understanding of what's really going on here? No way. I need to know we got a solution in hand by the end of the week. Tell me what it is, so we can start, getting on with it. So a lot of it's an organizational patience, if you will, to be able to go through this process. And being willing to kind of change how it is we think about, where we start that. Because if you always expect if you always have to predefine the solution before you can get started doing this work, unless you have the unless you have the agreement that we might end up in a very different place than what I just put on the table for you here, it can be really problematic, right? Because you've already just put a whole lens on this whole project right from the outset about what you think the solution is going to be. It kind of defeats the whole point of going through the process. So oftentimes the problems that we take on at the very beginning are problems that we all agree that any solution that we've come up so far hasn't worked, you know, or isn't working the best that we think it can be, which is oftentimes a lot of the problems that we take on. So that means like every attempt, every process that we followed to put the solution in place today hasn't worked. We need to try approaching this problem differently. And honestly, that's probably one of the best ways in which I've been able to gain that kind of acceptance. Is like, look, you've done it your way for this long and we're still in a problem. It hasn't worked. We need to really think about how we're going to do this differently. And so that's been a platform for doing it that way.
It helps that the leadership is really patient. We never ask for stuff to happen really quick.
Did everybody understand who that comment just came from?
Ryan?
Yes.
So, you know, what you're describing is a process where you have some big problem and big thing you need to tackle, and that, for example, as you just stated, nobody's been able to solve this, so we now take it back to the bench almost. But I think kind of what Kevin may be getting at, what I was going to ask is, well, are there different processes for dealing with this?
Oh, yeah,
could
great.
you know, for smaller problems, could you come up with solutions, you know, try to analyze the problem quickly, and then try to come up with a solution and iterate, and if it doesn't work, and then adjust the solution. So, I mean, different ways of getting to the same goal.
Yeah, yeah, definitely. Thanks for bringing that up. You know, we take this process and the maximum process is probably 90 days, right? Not counting how many times you need to prototype and iterate at the back end. But we want to keep it at 90 days, right? Because what you learn when you empathize, you know, is only valid so long, you know, you know, because if it takes you a year to do it and you're a year away from being in the field learning about people's needs and values and behaviors, and all that changes. And it changes probably a lot faster than we realize. And so we'd like to keep a rapid process, but we'll oftentimes take that 90 days and we'll shrink it down to 2 weeks. And we've even shrunk it down to 2 days. So we'll go this entire process in 2 days. And actually the one I referred to earlier about us being in Manhattan and going out to the apartments mostly of poverty level folks, that was a 2-day workshop. So literally we started that morning with doing that. And then by the end of day 2, we already had idea concepts in mind. Now, if you're going to bet $1 million project on what came out of a 2-day workshop, that's where I get a little uncomfortable. Right? And so it kind of depends on, you know, how deep do I think I need to go to come up with a solution that's really going to make a difference here? Or is this just something I need to inform a little bit more with an empathetic, you know, perspective up front, and it'll get us in a better place? So you can certainly amp it down to really rapid. You know, it's like, I just need to give this a shot of empathy perspective, and, you know, they're going to do a better job become of it. Or organizationally, we really need to design this right. This is critical. We need to get it right this time. Let's invest the resources to go through a deeper process.
So this seems sort of art and science combined, right? I mean, and so I'm curious about the science piece of it. How do you know if your sample size is big enough of the people that you've empathized with such that you can get to an overarching truth from what you've learned? I'm sort of curious about how you know.
Yeah, great. The quick answer is we don't. It's not, the sample sizes aren't large enough to really validate anything, and we didn't intend to. Like I said, in general, you know, in this rich research, 7 folks, if you see as a theme, likely to be generalizable. Sometimes it's not. But when you find that out is the next step of the process here in creating. Because we don't, you know, just do research and come back and say, here's the answer, let's, you know, sink a couple $1 million into doing this. The next steps of the process help you reduce your risk that the things you learned in the research are going to be valid or not valid. So let me dive into that, and then we'll see if you have a better answer there.
So Julie, that question was running through my mind as well. But I think that must say a lot about the culture of the organization who's sponsoring this type of work. So if there's such a big problem that we need to send it to our innovation center, and then we're going to develop prototypes based on maybe a dozen interviews with people, I mean, that seems pretty risky. Like that's pretty out there.
So tell me why you think it's risky.
Well, so I just the whole sample size If the problem is impacting, let's say, 1,000 people, and we're only going to talk to 8, it just doesn't, the math doesn't seem realistic to me.
Okay, so let me come back to it a little bit. So we're going to talk about the next step in the process.
Oh, dang, I keep getting that
Which
response.
de-risk stuff. Don't let me forget, though. Hold me to it. Hold me to it, because I think this is going to address it, okay? So we're at this part now where about creating. Finally, we get to make something based on, you know, our assumptions about where we think there's value here. One way, you know, obviously we know about brainstorming, you know, and here's where brainstorming does play a role sometimes in helping us identify a bunch of different ways in which you're going to be able to solve for this problem. Okay, I'm not going to spend a lot of time talking about this. I'll make 2 comments. One, brainstorm is actually a really, really structured and rigorous tool to generate a large ideas in a short period of time. Brainstorms are not conversations about ideas. Right? Because you know, I spend a lot of time going to meetings that are called brainstorming sessions where there's actually no brainstorming going on. Just because somebody might talk about a new idea, okay, that's awesome. That's not really brainstorming, okay? So if you want to know about brainstorming as a tool, it's really, really structured. It takes a lot of skill, actually, for you to be a good brainstormer. It's really hard to do. Actually. So if you ever have a chance to participate in a group that actually really knows how to do this and they've done it in a long time, you'll see the difference. It's pretty crazy. But it's only one tool. It's only one tool, and then one in which this kind of last point is you use it to generate a lot of ideas and push people's thinking, and then it probably raises the bar a little bit, and where you end up at the end is probably sometimes a little further than maybe where you went to previously. We use a lot of other tools to help people ideate and think about things, and I'll use a quick example here about like idea stretching techniques. So let's say your problem was this, and what you can do with you know, idea stretching techniques is focus on like, okay, how can we take the good parts of this and make it even better? So how can we use the energy of the children to entertain, you know, other frustrated passengers, for example? You know, and is there an opportunity there? How would you do that if we could do that? Explore the opposite. You know, let me think. I can't think of a good example. Question the assumption. One way of doing that would be we're assuming that there always has to be a wait. Right? There's an assumption built in here that waiting is something that has to happen. Does it really need to happen? How would this work if how could we make it work without any waiting? And then you'd be able to solve the problem from that perspective. Or lastly, create an analogy either based on the need or the context. So the context, the need for soothing or comfort. Okay, spas do that really well. How can I take elements of a spa and put them in this environment to address that need? Or context. What other contexts or situations do you find kids running around crazy? Playgrounds. So how does a playground help me think about what I might be able to do in this environment to help entertain, you know, the children? So examples of some of this is again another ideation technique where you're using analogies and techniques to, you know, think about your problems or opportunities in a little different perspective. Lots of different ideation techniques, and all of those are being filtered into the process at this point in time. The most important part, though, about ideas is that we're asking the right question. So you can come up with the best idea, but it's for the wrong problem, then it ends up not providing that much value anyway. The questions were informed by all the work that we did so far. Remember that opportunity? You know, we framed an opportunity, and then the solutions are meeting that opportunity. So most all of that work up until now is really about framing the right question. And there's so many examples out there in the world about the importance of this, or people recognizing the importance of understanding the problem. It's not really the solution that matters. And to get to the answer, you have to understand the problem. Einstein saying, if I had an hour to solve a problem, I spent 55 minutes understanding the problem and 5 minutes coming up with the solution. Because really when you get to this point, everybody thinks that innovation is about ideas, 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 ideas. I think like you shouldn't even be talking about ideas when you talk about innovation. Because it's actually just if you do a really good job at the other pieces of the process, the actual solution itself almost like it's there. You're almost guided right to it, you know? And so it doesn't turn into this, oh, the pressure's on because we got to think about the right answer to this. It's more like a problem-solving process. More like a problem-solving process. So this whole idea around creativity and ideas and getting crazy and wild and all that kind of stuff, it can help a little bit, but it's such a small piece of the process compared to the, all these other activities that I'm talking to you about, okay? This is where we start to de-risk. So prototyping, building things. You guys heard me with the design mindsets, make to think. And this is a huge, again, this is a skill of the design profession. Prototyping actually comes from the design world. Originally it was around things, products, right? And bringing things to life in low fidelity. But we can use that same skill and that same process to prototype services and experiences and interactions, and you'll see that happening a lot more today. So originally out of things like devices and, and form to more like things like how do we prototype interactions? How can we test out and do things in low fidelity around interactions to understand whether in fact that value proposition is there that we saw in our research, or that this solution really does meet that value or that unmet need that we guessed was there. And so usually in services, prototypes manifest themselves in the, you got to set the right scene. You usually have props, that are in between the interaction, whether it's papers or whether it's digital, communications, whether it's websites, telephones, whatever it might be. And then lastly, in services industries, roles are so important. And you can prototype all of these things. You can prototype all of them, which means like at Mayo Clinic, walking across the hall and asking a physician, hey, when you see this next patient, I want you to do this just a little differently today. Can you just let's say we're focusing on the prescription process. Could you talk to the patient when you get to the prescription process a little bit differently? Maybe use this tech tool, use this technique, because we just kind of want to see how it influences the conversation. So then they do it, and we watch. And we find out very, very quickly with very little investment whether what we saw in the research or what we hypothesized is in fact really there or not. And that's the power of live environment kind of prototyping. And that doesn't, again, is something that, doesn't really happen as much as I think it should be or could be happening in healthcare environments. There's a lot of things that get in the way of it. I mean, it's definitely not easy. You have to have access. You have to have people who are willing, to try something different. It's this whole make to experiment or make to learn. Be willing to experiment, be curious. And so at Mayo, you had the Spark Lab, and everybody who worked in the Spark Lab, the doctors, the clinical assistants, everyone was like, okay, I'm going to come work here, but you guys are going to really screw up my day, basically, and ask me to do a whole bunch of stuff that I may not be comfortable with. Same with the patients. So we let all the patients know that, hey, we're going to see you in this prototyping lab today. We're doing some different stuff in this prototyping lab. It might not work out, in the best way. Think about that. I can't tell you how many hundreds of patients, that we expose this to. And it sounds like, okay, they're crazy. Not once did I have one patient say, no, I don't want to be seen in your prototype lab today. And think about that, that's pretty impressive, right? Because they're probably not even feeling that well. And then I'm saying, I'm going to screw up your visit a little bit. And we didn't say it that way, obviously. I don't think it would have worked so well if we said it that way. But it just, particularly in medicine and healthcare, there is a huge kind of interest in doing things for the good of making the healthcare system better, right? And so we framed it that way. The patient is like, hey, we're trying to figure out how to improve your care delivery experience, which is what we're trying to do, right? Would you mind seeing this environment so we can help understand and learn from it and make our services even better, for people who experience, Mayo Clinic in the future? Sign me up. Everyone, didn't have one ever say that they didn't want to. So this huge kind of what we believe may be resistance to messing with people's time and schedules and trying new things and experimenting, even with doctors and staff now, right? All doctors, or some doctors were just like, leave me the heck alone, don't mess with me. I just want to practice like I know how to practice. Okay, that's fine. We don't need everybody to prototype. We just need some that really want to figure out how to improve their effectiveness at care delivery. And the power of doing that was amazing because the things that you see when you try stuff in these environments are things that you learn that you would have never been able to learn in your research or, in talking to people, observing, any of that kind of stuff. It's not until you actually put it out there and you watch how people respond. They actually see stuff that you might not have seen before. So we did that in live environments. That's what I've talked about a lot. But we also use simulated environments too as sometimes a prelude to what we decided to put into the live environment. This was from, again, some work at Mayo Clinic where we were redesigning literally we took on a huge project to reimagine outpatient care delivery. And we manifested some of the ideas in a 3,500 square foot foam core clinic, including 4 or 5 exam rooms, some staff support rooms, a lobby space. And that's all built out of foam core. You guys know what foam core is? It's kind of like this stiff board that you can cut really quickly. You know, and obviously we had some folks who were pretty darn skilled at doing some foam core work. Like we put monitors on, on arms there, and you can see some post-it notes around the space. And these are some of the early pictures, but then we brought people through, this space and had them react and respond to what this new environment was like. And that's, again, one of the assets of a prototype is that it shifts context. Okay, prototypes shift context. And you can shift that context in a number of ways. In this way, we're just get them out of the regular environment, put them in a really bleak white environment like this, and have them pay attention to some subtle changes. And because their mind shifted gears when they came into the space, we were able to have this amazing conversation about future things that weren't rooted back to the stuff that they're experiencing in their practice every day. So this prototype really helped shift context, and then we gathered feedback as people went through the space on these post-it notes. One of the things that we prototyped, and actually at that time we partnered with Steelcase, and Steelcase was doing some of this work with us as well on this specific project. And one of the things that we created in this design research project was this. It goes back to the research we did and the way that exam rooms were designed. And as we saw more and more use of the computer, which at that time was starting to be a really new thing, where like physicians had results on computers, they didn't have them on paper, and sometimes they didn't want to share those results with patients. Well, the computer screen's like way over on this desk, and the patient's sitting this way, and now I got to yank that computer over here and somehow push the computer around so I could show them what's on it. It was really, really awkward. And so as a solution to that, we ideated this half moon table with the computer at the center. The computer wasn't the focus of attention, because with the half moon, you're sitting side by side with a physician and you're able to kind of speak to each other as well. I was just at the Iora clinic here on the Dartmouth campus yesterday, and I walked into the exam room and saw that. That's super cool. I looked underneath, Steelcase. I did know that they did commercialize it, but it was so great to actually see the table actually come to life in some clinics. Does anybody else work in clinics where you're using half moon tables for outpatient visits? Not yet? Cool. So other ways of prototyping. So again, is to shift context, and it doesn't always have to be, ideally you're doing live environment stuff where I'm shifting roles, I'm shifting interactions, I'm shifting environments a little bit.